Hello, chairs, members. My name is Carlos Alarcon, and I am a health policy analyst with the California Immigrant Policy Center. For more than a decade, CIPC has been proud to co-lead the Health for All Coalition, which has been the main driving force to expand our healthcare system to include all Californians, regardless of immigration status. Our immigrant community has been deeply affected by the impacts of the passage of H.R. 1. Today, I will be discussing the impacts on public charge, concerns that we're hearing from our community on the ground, and what we know so far about data sharing with Department of Homeland Security and ICE. Starting with public charge, this is a test applied when immigrants seek to adjust their status. During this evaluation, a government official, an immigration official, decides whether this individual is likely to become dependent on government assistance long-term. For programs like supplemental security income, temporary assistance for needy families, general assistance / relief, and Medicaid for long-term medical care in an institution like a nursing home or psychiatric hospital. If someone is deemed a public charge, they can be denied the ability to adjust their status. This creates a fear in immigrant communities from accessing basic programs. Now, the majority of the immigrant community does not qualify for these public benefits to begin with, but H.R. 1 kicks almost all immigrants without a green card off of the few benefits that they did qualify for. Now, these changes reduce the impact that public charge has. However, it's the fear that impacts our communities the most. Even years after the Medi-Cal education and enrollment campaigns that we did, the fear of public charge still haunts our communities to this day. And these fears have been even multiplied by the reports that HHS is providing Department of Homeland Security access to the records of all people who have used Medi-Cal, even if only for emergency services. And to answer your question from the previous panel, Madam Chair, people are scared. Rightfully so. People are scared that ICE will know where they live, will know where they get their health care. They are scared that ICE will stalk their homes or their hospitals and wait until they are no longer in a private area to kidnap them without a warrant. At first, community members would weigh the options of switching from in-person appointments to telehealth appointments, but now we have community members who are contacting their health centers and their enroller organizations and asking them to disenroll them from Medi-Cal coverage. Then these individuals will potentially be subject to the Medi-Cal enrollment freeze in January 1st, 2026, meaning they will be frozen out the program entirely. We are even hearing that some Latinos with lawful status are questioning if they should disenroll from Medi-Cal themselves due to how racially targeted the ICE rates have been. They don't want ICE to see a Latino last name in the database and then going after them or their family who may be undocumented. And if an individual disenrolls, that will not necessarily protect their data, since we don't know the extent to which how much information HHS has already shared with ICE. Because of the attacks on our immigrant community's access to Medi-Cal in both the federal and state budgets, our community members are having a hard time keeping track of it all. And they are having an even harder time deciding what the proper decision for their healthcare situation is. Last month, I was contacted by a community member who needed a surgery. They wanted to enroll in Medi-Cal, but they are concerned about the data sharing, rightfully so. He didn't want his information shared with ICE. He wanted to wait to see how this played out in the courts. But because of our state budget decisions, this individual is now forced to choose between their health or their safety because the Medi-Cal enrollment freeze is looming ahead. Look, now more than ever, our immigrant community's health and safety is under threat, whether it be from our access to health coverage, being stripped away, or because we're scared to step out of our door due to the violent immigration enforcement. California must once again champion policies that catalyze our public health system forward rather than freezing our communities out of it. Thank you so much.